the Caregiver Connection podcast by Best Care, where we dive into new topics each week, drawing inspiration from our insightful and educational blog posts. We're committed to providing valuable information that impacts both home care clients and caregivers. Without further ado, let's jump into this week's episode. Benefits of walking for seniors. Walking is one of the most underrated tools for maintaining health and independence as we age. Unlike many exercise programs that require special equipment or gym memberships, walking is accessible, affordable, and adaptable to nearly any fitness level or lifestyle. We've put together these walking tips for caregivers who are supporting in-home care recipients, but the advice applies to all seniors who want to prolong their quality of life. Keep listening for specific tips around an accessible walking technique known as Tai Chi walking. Whether you're helping a loved one manage a chronic condition or simply following a doctor's orders to stay active, know that walking provides both physical and mental health benefits. Let's explore practical strategies to make movement part of your daily caregiving routine. Please note that before you encourage your recipient of care to start any new physical fitness program or activity, they need to consult their healthcare provider. Proven health benefits of walking for seniors. Research consistently demonstrates that walking can reduce the risk of many age-related diseases. Yes, just consistent walking. It's truly preventative medicine for your aging loved one. Improved cardiovascular health. Brisk walking for 30 minutes a day, 5 days a week, reduces the risk of heart disease, one of the leading health threats for older adults. Walking strengthens the heart, improves circulation, and helps regulate blood pressure. Better longevity and quality of life. Seniors who walk regularly live longer than their sedentary counterparts and report significantly less stress and better overall quality of life. Better nighttime sleep. Walking improves sleep quality, which is also beneficial for a wide range of health and cognitive functions. For seniors concerned about maintaining mental clarity, regular walking is a key strategy. Improve mobility. Walking enhances flexibility, balance, coordination, and overall mobility. Decrease risks of falls. Better balance and coordination means fewer falls, a leading cause of injury and hospitalization in seniors. Walking also reduces the psychological fear of falling and anxiety that often prevents older adults from staying active. A strengthened immune system. Regular walking boosts your body's ability to fight illness and recovery from injury, according to studies. More social connections. Walking offers natural opportunities for seniors to engage with their community, whether joining organized group walks, walking with family, or simply greeting neighbors. Social engagement combats isolation, a serious health risk for older adults. Understanding Tai Chi walking for seniors. Tai Chi walking is a mindful approach that is growing in popularity. It combines traditional Chinese martial arts principles with walking, creating a low-impact practice. What makes Tai Chi walking different? Unlike typical walking, which uses momentum to propel you forward, Tai Chi walking eliminates the pushing motion entirely. You can move slowly and deliberately, and some call it a cat-like walk, while maintaining complete control of each step. This conscious, controlled movement challenges your body differently than conventional walking. How does it improve balance? Tai Chi walking enhances proprioception, which is your body's sense of where it exists in space. It strengthens legs and core muscles and can help you train your nervous system to recognize and correct imbalances before they become falls. Research shows that Tai Chi walking challenges balance more effectively than typical walking, forcing your body to stabilize itself continuously. Who benefits most from Tai Chi walking? Curious if Tai Chi walking for seniors is realistic? It's actually remarkably accessible for all ages. It's easier to learn than a full Tai Chi practice, even for seniors with cognitive impairment or dementia. The basic technique requires minimal knee bending, making it safer for those with joint concerns. How should seniors get started with Tai Chi walking? Soften your knees and shift your weight to one leg. Pick up your other leg and place it forward, heel first. Slowly pour your weight into the forward leg, then lift your back heel and step. Do all of this without momentum and keep your body upright and steady. One Tai Chi instructor recommends her students imagine balancing a teacup on their head. Start with just 2 to 4 steps, focusing on each movement while breathing naturally. You can do this anywhere, your living room, a hallway, or outside. Walking outside versus treadmill walking. There are definitely benefits to walking outside when possible. Being out in nature can reduce stress, improve mood, and provide sensory stimulation that positively affects cognitive function. Walking outside in the sun provides vitamin D exposure and even supports natural circadian rhythms. Walking on varied terrain also challenges balance more than flat surfaces do, which can strengthen stabilizer muscles. However, outdoor walking has its drawbacks. Depending on the climate, and Minnesota can certainly experience weather extremes, there will be definite safety concerns caused by ice, snow, wind, rain, and heat. We've outlined some cold weather tips and hot weather tips to help mitigate these risks. However, it's important to watch the weather and keep your loved ones safe. Are there any benefits of treadmill walking? Yes. For many seniors, walking on a treadmill is a more practical practice. Treadmills provide a controlled environment, adjustable intensity, and increased safety. Treadmill walking allows walking consistently regardless of the weather. Many seniors find treadmills psychologically easier too, since the moving belt provides a sense of propulsion. However, treadmills don't challenge balance the way outdoor walking does. That's why a varied routine that includes all 3 kinds of walking, indoor, outdoor, and Tai Chi, matters. Walking safety tips for seniors. Besides watching the weather and consulting a physician, there are still a few steps you can take before starting a walking routine. Make sure your loved one warms up and stretches before walking to help reduce joint stiffness and muscle soreness. Wear proper footwear that prioritizes stability and comfort. Check feet regularly for redness, swelling, or blisters, especially for those with diabetes. Stay hydrated, particularly during outdoor and warm weather walks. Stop immediately if there is dizziness, breathing problems, or chest pain and seek medical attention. Walk with a companion or arrange group walks to add accountability and safety. Making walking a sustainable habit. The key to enjoying the benefits of walking is consistency. Many seniors revert to sedentary habits after their initial motivation fades. You can help your recipient of care build sustainability by starting small. Even 10 to 15 minutes count. Scheduling walks at consistent times of the day and/or week. Walking with a friend or family member for accountability. Using a pedometer to track progress, and varying the route to maintain interest. Walking is an excellent, accessible exercise for maintaining fitness, independence, and quality of life. No matter which type of walking is most appealing, the most important step is the first one. Best Care understands the importance of staying active and maintaining independence as you age, and we're here to help with any questions about family caregiving. Contact our team to explore how we can support your loved one's health and wellness goals. If you find this podcast helpful, share this with a friend, leave a review, and don't forget to subscribe. Contact us today for expert guidance and support. Visit bestcaremn.com. Thanks for listening to the Caregiver Connection.